Hello, how you doing?
I'm doing okay, thank
All right. My name is Guy. I'm your psychiatric mental health nurse practitioner. What's your first and last name?
you. Sarah Matthews.
Sarah. Nice to meet you.
You as well.
What's your birthday?
January 1st, 1991.
Okay, so how old are you?
I'm 34.
Okay, Sarah. What brings you in today?
Just overall, just feeling really down and lacking the energy and joy that I normally have.
Energy and joy you mentioned. Joy in what? What kind of stuff do you enjoy doing before that you feel like you don't like? You
I
don't
used
have
to
any?
like to go out with friends, and I also used to enjoy reading books and listening to music. I've just not really been feeling it lately.
Okay. And what kind of symptoms have you noticed, say in the last 6 months?
Just I'm feeling a lot less energetic. My appetite has gotten really bad too. Just don't really feel like eating. Yeah.
So you've had issues with your appetite. You've had lack of interest in the things that you used to love. Your sleep. What did you mention about your sleep?
So my sleep kind of goes up and down. Sometimes I just all I want to do is sleep, and I feel like I can just sleep the whole day. And then other times I'm having trouble falling asleep and staying asleep.
Okay.
Yeah.
Okay. Now, recently in your life, have you had any? Are you married? Do you have any people around you? Husband, kids?
No, I don't have any children, and I recently got divorced.
Okay. And before your divorce, how were things?
I was happy before. Yeah, I feel like I was happy generally.
So all of this started. When did you get divorced?
Just recently.
Okay. So did these symptoms kind of happen almost at the same time or start after? Okay.
Yeah.
Okay. Gotcha. Your energy levels, how have they been?
They've been definitely not what they usually are. I'm just kind of just feeling really low. Yeah.
Gotcha. Alrighty. What kind of things do you like doing? What do you enjoy doing?
Right now, pretty much nothing.
Before this, what kind of things did you really enjoy?
Reading, listening to music, going out with friends.
Yeah.
Yeah, those kind of things.
Gotcha. And most of those, you don't really.
No, and I don't really enjoy my job anymore either. I'm a teacher, and
Okay.
I'm not really liking my job
Gotcha.
anymore either.
So all of that how has that been impacting your job as a school teacher?
I feel like I'm not as interactive with the students, and I'm not as patient either.
Okay. Gotcha. All right. Usually, when we have patients who report these kind of symptoms, they also tend to mention thoughts of, harming themselves or harming others. Have you ever had those thoughts?
Yeah, I've had them kind of on and off.
Yeah.
If harming myself, not others.
Right. So just thoughts about killing yourself, but no thoughts of harming other people.
Yeah.
Okay. Yeah, that must be very hard. Now, have you had any body in your family with this kind of history before?
Yeah, it runs on my mother's side.
Mother's side, okay. So did any of them have depression as a? Okay.
Yeah, my mom struggled with depression as well for a long time.
Okay. And tell me a little bit about your social life. Do you drink? Do you smoke? Do you do any drugs?
No, I don't drink. I don't smoke. I don't do drugs.
So not even socially?
No.
Okay, gotcha. Is anyone in your family drink or smoke? Okay.
Yeah, both sides of my family do.
Okay. What do they do? Do they do alcohol,
All
drugs?
yeah, everything. Drugs,
Gotcha.
alcohol,
Gotcha.
smoking.
And did you live around that growing up, or did you kind of
Yeah, I lived around it quite a long time.
Okay. In your opinion, what do you think, or how do you feel about have you had any medications? Have you seen anybody and had talked about any medications before?
I was on medication actually.
Which ones?
Lithium, Abilify, and Lexapro. just kind of trying to try different ones to see what was gonna help me.
Okay, so what did they give you those medications for?
For depression, I think they also were giving me some medicine for mood swings as well.
Okay, for mood swings.
Mm-hmm.
Gotcha.
Yeah.
Okay. When it comes to the situation that you're in right now, have you been like hearing any voices or seeing things at all?
No.
Okay. So no hallucinations or anything like that? No. Okay. Gotcha. Your appetite, how's your appetite been?
No, it's been pretty poor. Yeah. I'm not
Pretty poor, you said?
Yeah, pretty
Okay.
poor. I'm not eating much.
Gotcha.
Yeah, it's caused some weight loss.
Some weight loss, okay. Over the last, let's say 6 months, how much weight loss have you had experienced?
Maybe like 20 pounds.
Okay,
Mm-hmm.
okay. Gotcha. Do you have any conditions, like any physical conditions going on, any medical conditions going on
I'm
with you?
pretty healthy.
Okay, pretty healthy. So, did you visit the doctor the last 6 months for any issues?
No,
Okay, no physical issues.
no.
So it's all, you know, the feeling low and all that. Gotcha. Who are the main people in your life socially? So I want to just see how, what social interactions do you have? Your mom, your dad? I know you did mention you're divorced.
Yeah, I have my brother, really close to him.
Okay.
I have a couple friends I would consider close friends. But like I said, I've just not really been having the desire to even hang out with them.
Okay. Gotcha. And how have they been, what in their opinion would you say, what have they been saying about your situation? The fact that you've been not hanging out with them, how have they seen that?
I think they took a little personal.
Yeah.
But yeah, my brother's been understanding, but my friends not as much.
Okay. Gotcha. Okay. Do you have any allergies to any medications?
Just contrast dye.
Contrast dye.
Mhm.
Gotcha. As I said, you mentioned about having thoughts of killing yourself and all of that. Tell me a little bit more about those.
It's just when I feel at my lowest. And just sometimes I feel like that's the way out.
Okay, you feel like it's a way out. Okay.
Yeah.
And have you ever like had a plan about how you go about killing yourself?
Yeah, a couple of times.
What plan did you think about?
Overdosing. Crash my car.
Yeah.
Yeah.
Okay. So you thought about crashing your car and overdosing. Anything else?
No.
Okay. Did you share this with anybody?
No.
All right. A little bit more about your interests. You did mention friends. You did mention reading. Do you have any other interests apart from those?
Music and art.
Music and art. Okay. Do you do them with somebody, or do you just do them by yourself?
No, by myself.
Okay. And how have those been recently?
Just not been feeling like it.
Okay. Gotcha. Okay. I'm just going to do a quick assessment on your mental. It's called a MMSE, a mini mental status exam. I'm gonna use like a little paper sheet. I'm just gonna ask you a few questions and I'll direct you through it. Okay, let me just grab the paper here. Okay. So this is the mini mental state examination. So basically what I'm gonna do, I'm just gonna ask you, what year is it today?
2025.
All right, what season are we in?
We're in summer.
Okay, what's the date and the day of the week?
Today is Monday, August 8th.
August, okay, August 12th actually.
Oh, sorry, yeah.
It's okay.
Time is flying.
Got you. Where are we right now? Like what state?
We are in Ohio.
Okay, what town are we in?
Cincinnati.
Okay. What hospital?
I think I'm not sure. I forget which hospital this is, but
Okay.
yeah, I think it's is it Tri Health?
Yeah, you got it.
Okay.
And what floor are we on right now?
The 7th floor.
Okay, awesome. I'm gonna list 3 objects really slowly, and I'm gonna ask you about these objects later. Okay. All right. Number 1 is phone. Number 2 is pen, and number 3 is paper. Okay. Can you count backwards? Can you count backwards from 100 by sevens? So like 193.
Yep. Probably not without my fingers though.
It's fine. You can.
Okay.
You're good.
100, 93. 89, 88, 87, 86.
Okay. Awesome. What are those words that I asked you to remember? Those 3 words.
I think you said pen. Was it paper? And I think I forgot the 3rd one.
Phone.
Oh, phone.
Yeah.
Okay.
That's okay. All right. I'm going to show you 2 objects. This is a wristwatch. Okay. And then a pen. Okay. There's those 2. Okay. Sorry, I was supposed to have you name this one. So what is this?
That's a watch.
Okay. And what is that?
A pen.
Okay. Awesome. Can you repeat after me? No ifs and or buts.
No if, ands, or buts.
Okay, thank you. I'm going to give you a paper. I'm going to just ask you, here you go. Fold it in half and put it on the floor. Fold that paper in half and just put it on the floor. Quickly. Okay, thank you. You can pick it up. Thank you. Alrighty, I'm just gonna. Okay, can you read what is on the paper?
This place is cold.
Alright, thank you so much. Alright. Make up a sentence about anything.
Like anything?
Yeah.
I would prefer to be on the beach right now.
Okay, nice. All right, so we're going to have you do a copy of this right here.
Like to draw
That
it?
drawing, yep.
Okay.
Awesome, thank you so much. All right, I'm just going to put this over here. All right, since you're divorced, who have you lived with?
By myself.
You live by yourself, okay. And you're going up to work and everything, all right. Any issues with work?
I mean, I just say that my performance hasn't been very good lately.
Okay. So what about your performance?
They're just feeling like I'm not as hands-on with the kids and their learning, and
Okay.
I've lost my temper a couple of times too,
Gotcha.
which I didn't used to do.
Okay. Which is not like you.
Yeah.
I'm sorry to hear that. Most likely, as healthcare professionals, we see situations like this a lot. A lot of different things could cause your symptoms, anywhere from, depression to, bipolar state, because in bipolar you do have episodes of depression. It could just, also be
Can it cause the mood swings too?
mood swings.
Yeah.
So that could also be anxiety. Do you also experience a lot of anxiety?
Sometimes.
Yeah.
I guess I'm a little more anxious lately.
A little bit more anxious. Okay. And when you get into these anxious places, what other symptoms do you experience?
Sorry. Just kind of wanting to be away from that space, wherever it is. I just want to leave.
Yeah. Is there anything that triggers this anxiety? Like, do you have a fear of maybe planes, cars?
I do have a fear of planes, but like just in general lately, I feel like I've just been more anxious in general.
Okay.
I guess just due to the uncertainty of life right now. So yeah.
Okay, I see. And you did mention, as I was saying, there's a lot of things that could cause what you are going through. Putting all the symptoms that you've had together, you did mention that it's lasted for at least 6 months.
Yeah.
Okay. So what we're looking at most likely could be also an episode of depression. It could be a diagnosis of depression. Not only that, you have a lot of other things that could have caused this. So we're obviously going to, I think we should come up with a plan to see how we can improve most of the symptoms. So you do mention the fact that you have, you've lost interest in going out with friends, with reading, with doing a lot of activities that you used to enjoy, your performance in school as a teacher has suffered, your relationships have suffered too. So we're just here to support you and see how we can, make the best to get you back to your normal life, normal state of functioning, I should say. There's different medications that they use, is what they call SSRIs. They are typically used to help our patients who are depressed. There's other medications like MAOIs as well. It's a set of different medications that I would like you to start on. You did mention that you only have allergies to dyes. Yeah. So yeah, we'll definitely try the medications.
Susan Howell.
But another thing that we're going to do is also cognitive behavioral therapy. So cognitive behavioral therapy is going to help you to be able to deal with a lot of the symptoms that you've been facing. We're also going to go through a lot of different techniques to manage your anxiety, deep breathing. We're going to work through, we're going to give you a referral to a few people that can help you manage this anxiety. Okay. Did
Can you take a message
have any
from
questions
Susan Howell
regarding that?
What is that?
No, I was just asking if you have any questions regarding the plan that we have.
No, I don't think I have any questions right now.
Okay. Alrighty. Well, again, thank you for coming by. We'll definitely keep